All right, so we're going to be starting on drug altered consciousness. This is our last section of chapter 5. All right, so when we're talking about drugs, we use the term psychoactive drug to make essentially a specific statement about what the substance is capable of. So, psychoactive drugs are capable of altering attention, memory, judgment, sense of time, self control, mood, and perception. There are two major classifications of psychoactive drugs. One of them is uppers, and the other is downers. Stimulants are known as uppers. And then that's any substance that will increase activity in the body and nervous system. The most common of these is caffeine, which we're going to be talking about more in a little bit. Depressants or downers are substances that decrease activity in the body and the nervous system. The most common of these is alcohol. So uppers and downers can be really common. They can also be illicit drugs. They could be legal. And it just depends on the drug itself. When we're talking about usage of drugs, we talk about two major types of this as well. So we have instrumental use. This could be the use of an anti-inflammatory for muscle pain or antidepressant for depression. This is using a drug for its intended medical purpose. Taking NyQuil, for example, to suppress a cough and go to sleep. Recreational use, on the other hand, is the focus on experiencing the psychoactive effects. So the feeling of getting high or somehow altering your consciousness. For example, some people will drink NyQuil in order to get high, or they will use opioids in order to get high and feel relief from psychological pain or addiction. But instrumental use of an opioid would be as a painkiller after surgery. So some drugs only have recreational use. Some of them really are only instrumentally used. Like you're not going to use ibuprofen to get high and probably kill yourself before you have those effects. But some drugs can be used both ways. So oftentimes psychoactive drugs can be misused and abused, especially within recreational use. And so drug abuse is misuse that causes some sort of harm to the individual who's taking that drug. Instrumental use is short-term use, maybe just trying it out a couple times. Social recreational use is occasional use for pleasure relaxation. Think people who get high with their friends at a party, or people who will drink with their friends. Intensive use is daily use with elements of dependence, versus compulsive use, bless you peanut, which is intense use and extreme dependence. So the difference is essentially the extremeness of the usage. So intensive means they're going to use it every day. If they didn't, they'd probably be a little irritable, but it wouldn't be a big deal. Compulsive is like they have to have it in order to maintain their day-to-day life. Misuse can oftentimes become abuse, and it can happen quickly. And it depends a lot on the individual, though. For some people, they can drink alcohol socially for their entire life, have a glass of wine a couple days a week for dinner. It's not a big deal. But other people become alcoholics in a few weeks of their first drink. So it really just depends on the person. Some people, opioids are really powerful. For other people, they don't feel great under the influence, and they're unlikely to abuse those drugs. But drugs like painkillers are very powerful, and they're more likely to spur abuse and addiction over time. Why do people use these substances in the first place? Well, oftentimes people will start off with instrumental use like opioids, and then their body becomes addicted, and then they will seek them out. But oftentimes people are also just looking for something to kind of change their perception. They're looking to try things out of curiosity, looking for meaning or escape from some aspect of their life, to cope with some pain, psychological or physical, and then the immediate pleasure. Of course, we all recognize that there's going to be delayed punishment, whether it's the cost of having to find more, social stigma, or long-term abuse and physical health consequences because of abuse later on. When drugs are mixed together, we call this polydrug use. And when drugs are mixed, they frequently have different and multiplied effects. And this is what can cause accidental overdoses. Most of the time when drugs are being sold on the street, they're being mixed with other substances, and the person who's buying those things and even the person who's dealing those things doesn't often know what it's been mixed with. And this can really lead to overdose. So a lot of people you probably have heard about this. There's a really big heroin epidemic right now. It's part of the opioid crisis. Heroin's an opioid. And people are taking this and their body may be very used to the heroin and have really high tolerance, but it's being mixed with a drug called fentanyl, which is a super, super powerful version of an opioid. And if it's mixed with fentanyl, it's very easy for them to, their body to not be used to it and to overdose on it. So when drugs are interacting with one another, we call it a drug interaction, we can see that the combined effects of the two drugs may exceed the addition of one's effect to the other. This can happen with legal and illegal drugs. So think of a person who's taking a painkiller for a surgery and also drinking. You're going to have a multiplied effect. It's not just going to be like, I had a drink, a little buzz from that, and then also had the painkiller effects. The two added together makes a much more extreme effect. It's a case of like two downers or two depressants working together. If you had caffeine and ecstasy, which are both uppers, you might have problems that way. But if you mix an upper and downer, like alcohol and caffeine, like a Red Bull and vodka, you can have different effects. So people have to be very, very careful about drugs being mixed together because we do see drug interactions that occur that are really bad. Even over-the-counter prescriptions can oftentimes mix with our substances. So there's a lot of drugs people take that shouldn't be taken with alcohol or may have a different type of effect with nicotine. So women on birth control who smoke have a higher rate of stroke, and they have to be very careful about that. That's not necessarily a drug interaction, the psychoactive effect, but it can have harmful consequences for that person's body. So drug dependence, I've mentioned this a couple times, but addiction is physical dependence. So this is the compulsive use of a drug to maintain bodily comfort as indicated by the presence of drug tolerance and withdrawal symptoms. These withdrawal symptoms is this feeling of physical illness and discomfort after the addict stops taking that drug. This can happen even with caffeine. If you're a normal coffee drinker in the morning, or your parents are, and you stop drinking caffeine, you get headaches, you feel irritable, you just don't feel great. And that's pretty mild compared to the withdrawal symptoms of like alcohol withdrawal for alcoholics or people with drug or alcohol dependence, excuse me. And then people who are trying to quit opioids, they can have, they feel like they had the flu, vomit, nausea, shaking. They can even sometimes have strokes and other really harmful consequences from that. Drug tolerance is the reduction of the body's response to a drug. So the first time you take a drug, you'll get this super high feeling, but then the next time it'll be a little bit less, the next time a little bit less, until you actually need that drug just to maintain basic functions on the day-to-day basis. There's a really interesting video in the playlist. I think it's called Nugget. It's a little bird. You see it essentially going through the process of becoming addicted to a drug, increasing the drug tolerance, and then the withdrawal symptoms. Psychological dependence is a little bit different. That's the drug dependence that is based primarily on emotional and psychological needs. Oftentimes, people who use marijuana regularly will have psychological dependence. Same thing can happen with cigarettes. It's physical as well as psychological, but the person gets used to the routine where they have a cigarette in the morning when they first wake up, with their cup of coffee when they're driving into work, and they like that routine, they like that feeling. Same thing can happen with a glass of wine after dinner, or even your cup of coffee in the morning, just that warm, delicious aroma, and you feel so good and warm and fuzzy when drinking your coffee. That can be psychologically dependent as well. So a person who thinks that they might have a drug or alcohol problem should ask themselves these questions. In the past year, did you ever drink or use drugs more than you meant to? And have you ever felt that you needed or wanted to cut down on your drinking or drug use in the past year but couldn't? If you respond yes to either one of these things, you may have a drug or alcohol problem and you should seek help from a doctor. Okay, so we're going through the different classifications of drugs. First, we're talking about uppers. Amphetamines, these are used sometimes for weight loss, for like that super high feeling where this like buzz. But it's also used instrumentally for ADD and ADHD. Now you're probably thinking, okay, so ADD is attention deficit disorder, and ADHD is attention deficit hyperactivity disorder, which is actually the true name of the disorder. Why would you give someone who has hyperactivity an amphetamine which is going to make them more energetic? That seems counterintuitive. Why would you give someone who can't stop moving something that will make them not stop moving? But it's actually, it has the opposite effect in their brain. So for people who have ADHD, the prefrontal cortex, which has all that good inhibition and calming mechanism, the let's stop and take a moment and think this over mechanism in their brain isn't functioning at top speed. And so by giving the person amphetamines, it turns up those inhibition centers of the brain and allows them to have the normal controls that other people have in place in their brains. So ADHD medication, such as liking the name, Adderall is the big one right now. Ritalin used to be big in the 90s. There's a couple other ones as well. If a person doesn't have ADHD, it's going to produce a like super hyper focus, high energy kind of effect on them. If a person has ADHD, they're not going to have this crazy effect. It's going to just kind of bring their brains to normal, which is awesome. Cocaine is an increase in dopamine and noradrenaline, which produces the rush, and it's a very powerfully rewarding feeling. But what happens, though, is that the brain adapts to this chemical balance. It's like, oh, you're going to provide all this extra dopamine for me? I guess I don't have to produce as much anymore. Thanks for saving me the effort. But then once the cocaine is removed, it causes depression because you're no longer producing it yourself, and you can no longer feel pleasure, which is a term known as ahedonia. If you've ever heard of hedonics or hedonism, that means pleasure. And anhedonia means like without pleasure, so no feelings of pleasure. MDMA, also known as ecstasy, is a powerful rush of energy in ultrasensory experiences. It can cause an elevation in bodily temperature, and it can become fatal and cause liver damage, depression, and brain damage in the long run. Caffeine is another upper. This is the most frequently used drug in North America. It has a whole bunch of sources. Coffee, of course, soda, energy drinks, caffeine pills, chocolate. There's caffeine soap and caffeine lotions. Like there's all kinds of caffeine and a whole bunch of other stuff. It's also present in like a lot of headache medications like Excedrin. Those also have caffeine in there, and it's part of the reason people use Excedrin and it works so well for migraines is that it's a vasodilator. It opens up the blood vessels in the brain, which can release that tension headache. But if a person has too much caffeine or they're hypersensitive to it, it can cause insomnia, irritability, chills, a racing heart, elevated temperature. It does increase the risk of miscarriage for women, especially in the first trimester of pregnancy, so the first couple of months. And typically doctors recommend women have less than like 2 cups of coffee a day, and that's like 6-ounce cups of coffee. So, their vente is more than enough. And it can elicit withdrawal symptoms if you stop. So again, if you're a person who drinks caffeine normally and you stop, you might get some headaches for a few days. But typically it's relatively minor compared to other withdrawals. Nicotine is the second most commonly used drug. It is also an upper. In large doses, it can cause stomach pain, vomiting, dizziness, etc. Tolerance is very easily increased, and it's very addictive. Of course, there's a lot of negative health effects that are due to carcinogens in tobacco and the additives. So nicotine itself is harmful, but then also the additives that they add to cigarettes, cigars, and vape liquids are also very dangerous. So everyone always asks me, especially today, because e-cigarettes and vaping have become really, really popular, what's the deal with those? There's a lot of misinformation out there, usually by the companies that have made these vapes and e-cigarettes that, oh, it's so much less harmful than cigarettes, or you can use this and it's not going to cause you any problems in the long term. And that's false, and there's not a whole ton of information out there yet, but all the research is showing that it is still quite harmful. So e-cigarettes are devices that heat a liquid into an aerosol that the user then inhales because of the vaporized liquid. The liquid will usually have nicotine and flavoring in it as well as other additives. Even there's nicotine-free fluids, but they still have additives and flavorants and things like that. Nicotine in e-cigarettes and regular cigarettes is still addictive. E-cigarettes are considered tobacco products because most of them contain nicotine, which comes from tobacco. Now, I'm getting this information from e-cigarettes at the surgeongeneral.gov if you want to check out more information. On the FAU campus, all types of e-cigarettes and nicotine are prohibited. So you can't use chew, you cannot use cigarettes, cigars, or any type of e-cigarette. No Juuls, no vaping, none of that. Anywhere on the campus, including within your own vehicle. There are potentially harmful ingredients. So when people are using the vaping liquids, these particles are super, super tiny. And so they're considered ultrafine particles. And when they're inhaled, they go very deep into the lungs. There's different flavorants in there, such as diacetyl, I think is how you say it. It's a chemical that's linked to serious lung disease. It's actually, they call it popcorn lung because people who work in the plants that actually make microwave popcorn, the bag that helps make it pop and all the good flavors and stuff actually has this chemical in it. And people who work there have really, really terrible lungs, and they've actually had this like chronic lung infections. And this is due to this compound. We also see volatile organic compounds, and of course, because you're heating this liquid to a very high temperature very rapidly, there can be heavy metals such as nickel, tin, and lead from the device itself that gets vaporized, and then you're inhaling that and getting that into your bloodstream, which is a very, very bad thing. For people who are around nicotine and e-cigarettes, it can stunt your brain development up until age 25. You guys are in that prime category for problems to be occurring from e-cigarettes. Of course, we see addiction, mood disorders, and permanent lowering of impulse control. We also see harm in brain regions responsible for attention control and learning, the two things that you guys really want to be protecting right now. 20% of high school students report using e-cigarettes, which is higher than cigarette usage. For the longest time, cigarette use was going down, like pretty much since the 70s. It's been going down. We had really, really low rates in the early 2000s, but it's gone back up because of the rise of e-cigarettes. E-cigarettes usually contain higher levels of nicotine than traditional cigarettes do. So all Juul cigarettes, e-cigarettes, have higher levels of nicotine. According to the manufacturer, a single Juul pod contains as much nicotine as a pack of 20 regular cigarettes. So you know those Juul pods that I'm sure you have some friends who are using those. If they're going through one or two of those a day, they're going through like packs upon packs of cigarettes worth of nicotine. And that's really harmful, and it's very, very addictive. We also see that there's a link between the higher illegal use of alcohol and marijuana once people have begun to use e-cigarettes, and they're more likely to become addicted to those things as well. So please don't even try these things. Stay away from them. It really is something that is still not super well understood. There's not as much regulation around it as there used to be. Oh, there is around cigarettes. It was kind of like this like loophole that the tobacco companies found for a while to get to you guys. But please be smarter than that. Don't inhale anything except air, please. And like maybe the smell of chocolate chip cookies and baking. Like don't put anything artificial like this into your lungs. It's going to be a really, really bad idea in the long term. All right, so moving on to downers. The major category of these is narcotics. So opium is essentially the natural derivative from a poppy plant. It's been used for centuries to relieve pain. You guys learned all about the opium wars, I'm sure, in history class. But now opium is refined into morphine, codeine, heroin, methadone, Vicodin, Valium, all these different things that, if you've ever had a surgery, your parents have had a surgery, you've probably seen this prescribed before. Things that these compounds are very, very addictive. Your brain has opioid receptors primed for your beautiful natural endorphins, but when these things get essentially hijacked by opioids, your brain can't control itself. So like we talked about before, we're in the midst of an opioid epidemic. It's really, really bad in areas of our country. People are dying like crazy from opioid addiction, especially when fentanyl is added in. There is a reversal spray that you can get from the pharmacy. I don't think you need a prescription for it. It's called naloxone. The name brand is Narcan. What you do is you spray it into the person's nose, and it reverses the effects of an overdose within seconds. And so people who would have otherwise died can be brought back from the brink of death. It's quite incredible. Ambulances, police officers, even a lot of like school nurses are now carrying these things because they want to make sure that if anyone ever needs it, they have it on hand, because it is something that happens very quickly. As far as long-term help, what a lot of people are now using is called a harm reduction strategy for opioid addiction. So this is a treatment approach to drug addiction that seeks to reduce the negative consequences of addiction, but without necessarily requiring the abstinence of the drug. So for heroin users, they'll oftentimes be prescribed what's called methadone. Methadone is, sorry, my dog's barking at me. Methadone is a compound that is an opioid, but you don't get the feeling of being high from it. So it doesn't give you that powerful reward, but at the same time, it it coats those opioid receptors so the person's not feeling that that need to go get high all of a sudden. They can use this for people and slowly taper them down off of it over a long period of time instead of having to go through withdrawals in a really harsh way. Other communities are using what's called a free needle clinic. So in order to use heroin, it has to be injected into the person's arm. But of course, to inject it, you need a syringe. You probably know that you're not supposed to reuse a syringe over and over again because you could infect yourself with some pretty nasty stuff. But also because syringes are hard to get a hold of, people will reuse them, and they'll also share needles. And that's an obvious hazard. It's very easy to transmit all kinds of infections such as HIV and hepatitis. So some communities are offering free needle clinics. They'll give them free needles, and they'll even, or they'll do a needle exchange. So if you bring in a dirty syringe, they'll give you a clean syringe. Communities who have done this have seen very steady decreases in their infection rates, which is awesome. But some cities are actually going a step further. They're actually offering safe usage places where people can go. They have to bring their own drugs. They don't provide anything like that. But they'll give them needles. They'll give them a place to use the drug with essentially a nurse right there to watch them. And it's kind of been an interesting approach. A lot of places are very against free needle clinics and these usage clinics. But the nice thing is that, one, because they're under the supervision of a nurse, if something does go wrong, they have someone right there who can use the naloxone on them and bring them back. They're also, so we're saving money as far as transporting to an ER and having emergency services come out. You're making sure that they are getting the immediate treatment so they're not going to die. They're offering them a lot of information and literature about social services, addiction, treatment centers, and things like that. And we're also able to collect data for research relating to these things. So in the past, there wasn't any research on the biology of an overdose. We just know that people did overdose. But now, because they have people in these clinics, they can hook them up to different machines and different recording mechanisms and actually see what their body is doing during this process. So there's been a great body of research that's actually come out of these clinics. It does cost a lot of money, of course, to staff these things and to provide the materials, but it has proven to be cost effective compared to paying for ER visits and services that come out and save someone in their own home or on the street. So it is an interesting approach. So here's kind of an example, or a chart of overdose deaths from 2002 to 2014. You can see that there's been a steady increase. And you can see how Narcan then blocks the opioid receptors in the brain and kind of kicks the opioid out, and it makes it so the person doesn't have any of that high feeling for a short period of time. Also, some other downers, we have tranquilizers. So tranquilizers alleviate nervousness and stress. The common ones of these are Valium, Xanax, and Roofies. But it can cause amnesia and extreme relaxation response / intoxication, such as the date rape drug, and which all causes severe emotional depression. We also, so date rape drug and Roofies are obviously used generally for predatory purposes. So it's something that you don't usually see people taking for recreational purposes. These drugs slow down the normal brain functioning. We see slurred speech, shallow breathing, sluggishness, fatigue, disorientation, and a lack of coordination and dilated pupils. In higher doses, we see impaired memory, judgment, and coordination, irritability, paranoia, and thoughts of suicide. Some people do become agitated or aggressive. Using prescription sedatives and tranquilizers with other substances, in particular alcohol, can slow breathing and slow the heart rate and respiration and can possibly lead to death. So again, drug interactions are very, very dangerous. The other big downer, which you guys have probably all heard of, is alcohol. This produces feelings of relaxation and euphoria, and a large amount can cause great impairment until consciousness is lost. You can die from having too much alcohol in your system. This is called alcohol intoxication or poisoning. As Shakespeare put it about alcohol and sexual arousal, it provokes the desire but takes away the performance. Oh, good Shakespeare. Some people become relaxed and friendly. Other people become aggressive. It really depends on that individual. It doesn't have to do with the type of alcohol they're drinking. like, oh, tequila makes me frisky, but whiskey makes me angry. Like, no, that's in your head. Just different people react differently to alcohol in general. Alcohol myopia can occur. This is short-sighted thinking and perception that occurs during alcohol intoxication. That's when you see, the college frat boys who want to, I don't know, streak across campus naked or decide that they can drive their vehicle just fine. That's that alcohol myopia, that short-sighted thinking. Alcohol is abused very, very frequently. There's approximately 20 million people in North America that have a serious drinking problem, and 29 Americans die every day from an alcohol-related car crash. So it is a very, very serious concern, especially when it comes to drinking and driving or driving under the influence. Binge drinking is particularly dangerous. That's having 5 or more drinks for men or 4 for women in a short period of time. That means about one evening. This can cause permanent memory loss, especially in young adults while your brains are still developing. Now, when I say a drink, I think it's like 4 ounces of wine, 1 ounce of liquor, or 12 ounces of beer. So a serving size of beer is much larger than wine, which is much larger than alcohol, like straight alcohol. So people have to be very careful, especially with mixed drinks. It's very hard to tell often how strong a drink is. Beer and wine are a little bit easier to determine what the alcohol content is. So those are at risk for alcohol abuse. Individuals with family members who have an alcohol problem are at greater risk for alcohol abuse themselves. There does seem to be a genetic component. Women are at greater risk because alcohol is absorbed faster into our bodies but metabolized more slowly, and we're more prone to the long-term health effects of alcohol intoxication and alcohol abuse. So how to plan to moderate your drinking. So first of all, plan on how much you plan to drink beforehand and think about how you're going to manage and keep track of it. For some people, they'll keep track of like how many beers they've had by how many tabs, like, beer tabs or beer caps that they've had. It's a little bit harder for wine and for alcohol. Drink slowly. That means drinking less than 1 drink per hour, and eat and drink water with it. This is something that college students, they call it drunkorexia, where they won't eat all day, and then, because especially for young women, they're afraid of gaining weight, and there's a lot of calories, especially in beer. They won't eat all day, and then they'll essentially just drink all their calories at night. As a compounding effect, because they don't have any food in their stomach, they have nothing to absorb that alcohol and slow down the metabolism. But then also, they're just drinking way too much too quickly. People should work on limiting their drinking too early on in the social event. That way they can sober up before the end of the evening. They should be able to practice how to turn down drinks politely but firmly. We have all met that person, or you will meet that person who won't take no for an answer, really wants you to have another drink, do a shot with them. These people can be really, really hard to turn down. But practice politely turning them down. Or if you really have to, use a different strategy. Carry around a drink in a solo cup, a Sprite with a slice of lime in it, and tell them you're having a drink or a cocktail. It's very hard sometimes, that social pressure, to turn people down. But if you can always kind of fool them for a period of time. But the best thing to do is to learn how to relax and socialize without alcohol. If you need alcohol to get through an evening with your friends, you probably need to get better friends. Detoxification is the treatment of drug abuse, including alcoholism, which takes the patient away from the drugs in question. The biggest alcohol abuse organization is called Alcoholics Anonymous. They help people who have abuse issues with alcohol and walks them through a 12-step program in order to get them to abstain from alcohol. Now, Alcoholics Anonymous has a really good track record as far as like the public perception. There's not a whole lot of research that backs up that AA is the best of these models. There's also Narcotics Anonymous and Al-Anon for family members who have someone in their family who is an alcoholic. It helps them out. But there are medical ways to help a person who has alcoholism. There's medications that make them feel really sick when they have alcohol in their system, or it will make them not actually get that pleasant drunk feeling. So there's different medications people can take to learn to avoid alcohol. But there's also better therapeutic approaches as well. The problem with Alcoholics Anonymous is that they don't keep records on their, not their patients, but their the people in their organization because it's anonymous. And so there's no real evidence to support that they are the best approach. So if you know someone who's tried Alcoholics Anonymous but it hasn't worked for them, encourage them to seek out help from a psychologist who may be able to provide other more, I guess, evidence-based approaches to alcohol avoidance or on how to moderate their drinking. That might be helpful for them. Hallucinogens are mild stimulants, but the main effect is to alter sensory impressions. LSD, known as acid, or PCP, is angel dust. Peyotes and mushrooms are also part of this classification. They can cause agitation, disorientation, violence, and it affects the neurotransmitter system. They see things that aren't there. They have different sensory perceptions. Marijuana, the active ingredient is tetrahydrocannabinol, or THC. CBD is the other compound, but that doesn't get the person high. So the high compound is the THC. They feel a sense of euphoria and relaxation. Marijuana intoxication is mild compared to that of other drugs, but it can cause paranoia, hallucinations, and delusions, depending on the individual and how their body reacts to it. People can also be allergic to marijuana and makes them really super ill. There has been no known overdose deaths reported for marijuana, but it can cause physical dependence as well as psychological dependence, which is more common, and it can be very hard to quit. We do see lasting effects on attention, coordination, and short-term memory impairment. Now, medical marijuana is a hot topic right now, especially when there's states that are legalizing medical marijuana or making marijuana recreationally legal across the country. As far as drugs go, marijuana is more mild, probably compared to most of them, and even compared to nicotine and alcohol. It's relatively mild, but it is still a highly illegal drug in most states, and it is still illegal at the federal level, which is why it makes it difficult for different states to kind of go through the legalization process, because while it may be legal, say, in Colorado, the federal government could still step in and cause a lot of problems for dispensaries and individuals who are using. And also because it's been so tightly classified, it's been difficult to do research on marijuana because the clinics in question who are trying to do this research couldn't gain access to medical grade marijuana until recently. So there's still a lot of research being done. It's going to take probably another 5 to 10 years before a lot of information comes out. But CBD, which is the other compound, active ingredient essentially in marijuana, has shown to be quite effective for a lot of individuals. You know, your usage may vary, mileage may vary on that, but it does seem like it could be promising, especially for people who have seizures, people who are going through cancer treatments, glaucoma, and things like that. That's where the best evidence is. But at this point, the jury's still out and the scientific evidence is not in. So hopefully in the next 5 to 10 years, we're going to get more evidence either in support or against medical marijuana. Again, there's two main cannabinoids for the marijuana plant of medical interest. These are THC and CBD. THC can increase appetite and reduce nausea. THC can also decrease pain, inflammation, including swelling and redness, and people who have muscle control problems like Parkinson's and things like that. CBD doesn't make people high. These drugs are popular for recreational use because they're not intoxicating. It can be useful in reducing pain and inflammation. It could help control epileptic seizures and possibly treat some mental illnesses and addictions. The FDA and the federal government has not recognized or approved the marijuana plant as medicine, but states have made their own medical marijuana laws. It really depends a lot state by state what they do allow and how you get access to that substance. So in Florida, medical marijuana is legal, but you have to go to a doctor who has a specialization in that. You have to get a prescription. You have to go to a dispensary, and they'll only give you what's on your prescription. So say like oil or a vape or things like that. In California, it's a little bit different. You can go to any doctor. They would just give you a card. You can go to any dispensary, get whatever you wanted for whatever you wanted to do. So it's very different in certain states compared to others. And of course, many states now, Massachusetts, D.C., I believe Alaska, Maine, and of course Colorado, I think Washington and Oregon too have made it completely legal. Research, again, has been extremely limited due to restrictions on testing and drug trials with illegal substances, but that will be changing shortly, I'm sure. All right. Now, if you want to check out a fun website, this website called Mouse Party, if you just probably Google Mouse Party, it'll come up. You can't really do it on your iPad because you need Flash, but at least I don't think you can. I couldn't figure it out. But you see like a little tank of mice, and they're each having like a different like effect within this party. You pick them up, put them in a chair, and then it scans their brain. It'll show the neuroscience essentially behind each the different substances we've talked about. So check that out. It's kind of fun, and I think we are at the end of our chapter. Yep. All right, so that's the end of chapter 5. Hope you enjoyed it, and we're going to be starting chapter 6.